Hello, I'm Dr. Brandt Gibson, and yesterday we introduced you to the Gibson Method. We gave you Neuropathy Visit 1. Between Neuropathy Visit 1 and 2, there are certain things that are put into place so that in Neuropathy Visit 2, we can do a wide range of evaluation and treatment determination options so that we can say, okay, what are some of the causes of your peripheral neuropathy and why do you have the symptoms you have, and what are some things that we can do to help you? And this is a very, very important step, Visit 2 is. And so there's a couple different things we're going to do. Number one, we're going to determine any relationship between your medical, surgical, medication, and even social history to peripheral neuropathy. Are there any things that could be causing this? For example, are there certain types of diseases, whether it's diabetes, thyroid disease, kidney disease, lung problems, infections, heart disease, any of these things that could be causing or influencing at least your peripheral neuropathy. We also look at any medications you may be taking, so we're looking for any toxic neuropathies that could be going on. And we're looking at any social history type situations, like do you have high-risk behaviors, like high-risk sexual activity or IV drug use, or you drink a high amount of alcohol? All of these could be affecting your peripheral neuropathy. And by treating these pieces, you can actually help improve your peripheral neuropathy. We do an evaluation of your deficiency in certain nutrients to see if you have a deficiency type neuropathy or even a dependency type neuropathy. We're looking at certain vitamins, vitamin B12, B1, B6, folic acid, vitamin D. We're basically saying, okay, there's certain things that could be causing your peripheral neuropathy. We look at compression neuropathy. We look at, through x-ray and ultrasound, we're looking for any areas that could be compressing those nerves and causing a compression type peripheral neuropathy so that those pieces can be treated as well. And we look at autonomic neuropathy. We actually do a pseudomotor and QSART test to determine if you have a peripheral neuropathy. The idea is, as we're taking you through these things, we're saying, okay, we're ruling out different causes of your peripheral neuropathy or ruling in causes or contributing factors so that we can actually help you create a plan to truly manage the symptoms and control the disease processes or the damage that's happening to the nerves so that you can thrive and live with an extraordinary life. So some of the things we also do to prepare for Visit 3, we will usually do a biopsy at this time. We do a epidermal nerve fiber density biopsy in both legs, and we send it off to determine if you have a small fiber neuropathy. We send you off for a urine test to determine if you have any heavy metal type problems so we can actually evaluate and say, okay, is there a problem with the heavy metals that could be causing the peripheral neuropathy, because they can be treated. And we send you for a nerve conduction velocity test if you haven't had one, because what that does, that will also give us some things that we can actually do to say, okay, we're looking for deficiency neuropathy, we're looking for compression neuropathy, we're looking for a small fiber neuropathy versus large fiber neuropathy versus autonomic neuropathy. And all these things, as we're taking you through this process, we're evaluating to see what's going on. And then we also look at your history, like we said. The goal being to start the process saying, okay, what type of treatments are going to work for you? What are some things that you can do to manage the symptoms? But also, what are some things that we can do to control the nerve damage so it doesn't continue to get worse? Because peripheral neuropathy typically is progressive. This is Dr. Brandt Gibson, and this is your Neuropathy Nugget, day 46. And this was the Gibson Method, visit number